Hello, everyone. Welcome to the 12th episode of Truth Tracker, a podcast dedicated to combating political misinformation within the political scene of the United States of America. Thank you to everyone who's tuning in today to see this episode. Before we start off, I want to first urge everyone, if you've been on the channel before, to subscribe if you've enjoyed some of our past content, as well as like any episode that you've enjoyed, as well as turn on post notifications. That way, that you can be notified anytime we produce one of our new weekly episodes. Now, with that being said, our episode for today will be focused on public health, which is a very critical issue within the election, as well as a new issue that's arisen, especially from the end of the COVID-19 pandemic. And so, with that being said, there's no new updates on my end, and this episode is going to follow the same layout as the last couple episodes, where we bust 10 myths regarding public health and then hold our weekly civic engagement segment. And so, with that being said, let's just get straight into the episode. And let's get straight into episode 12, which is focused on public health. So, our first myth is that public health is only focused on responding to crises, specifically health crises. Now, public health encompasses many things, such as prevention, education, as well as long term health promotion, not just a specific emergency response, right? Because public health is actually a proactive measure of health rather than reactive. It includes initiatives like, vaccination programs, health education programs, and policies that promote healthy lifestyles. For example, the CDC often focuses on issues like obesity and tobacco use, which require long-term strategies rather than, immediate crisis management. And so this sort of misconception that public health is solely crisis oriented undermines the importance of preventative measures, and investments in public health as well as preventative health can lead to healthier populations and reduced healthcare costs over time, which sort of reinforce and emphasize the need for comprehensive public health strategies. And so, this sort of idea that public health is only about, crises management and emergency responses to public health crises are simply not true, right? Because public health is proactive, and so oftentimes it's focused on achieving, long-term health goals and focus on long-term strategies. And so that way creating a wide it's creating first off a wide response to the various health issues that are facing America, which can help create a more healthier population. And we got this information from the CDC. And so, therefore, this myth that public health is only about responding to crises is simply not true. Our next myth is that public health is primarily the responsibility of government agencies. Now, public health is not only the responsibility of government agencies. Public health is actually a collaborative effort involving, various stakeholders within America, such as, local communities, nonprofit organizations, healthcare providers, as well as individuals. And so, effective public health across the country relies on partnerships between government agencies, local organizations, as well as community members in order to support, public health initiatives. And so, or public health initiatives such as, community health fairs and vaccination drives. And so these initiatives often involve collaboration among different sectors of society to ensure, a large access and engagement from the community. And so there's sort of this misconception that public health is primarily the responsibility of government agencies, which actually is a negative, which is actually not good for society, as viewing public health as solely a government responsibility can lead to gaps in community involvement and support. And so it's important to engage diverse stakeholders in order to foster a more, effective public health system that addresses the unique needs of different populations, and different populations. And so therefore, it's important to recognize that public health is not primarily the responsibility of government agencies. It's a collaborative effort that involves, communities, nonprofit organizations, healthcare providers, and individuals, as well as many more entities. And so therefore, this myth that public health is primarily the responsibility of government agencies is simply not true, and we got this information from the CDC. Our next information is that vaccines are not necessary for public health. Now, vaccines are crucial for preventing outbreaks and protecting public health, as they've eradicated many diseases like smallpox, for example. because, or at the end of the day, vaccination not only protects individuals, but actually also contributes to herd immunity, which prevents the spread of infectious diseases. And so the resurgence of measles in areas with low vaccination rates actually highlights the importance of maintaining high immunization coverage and whatnot. And so dismissing the sort of necessity of vaccines actually poses a significant risk to public health. And so vaccine misinformation can lead to vaccine hesitancy, which results in outbreaks of preventable diseases like COVID and the flu. And so, public health campaigns regarding the importance of vaccinations are essential to educate communities about the safety and effectiveness of vaccines. And so, the sort of idea that vaccines are in their own separate category from public health is simply not true. Their vaccines and public health are both in a relationship in order to create a more healthier population within the United States of America. And so, this idea that vaccines are not necessary for public health is simply not true, and we got this information from the World Health Organization. The next myth is that public health spending is a drain on the economy. Now, this is not true, as investing in public health actually saves money saves money in the healthcare industry in the long run by preventing diseases as well as reducing healthcare costs. There have been studies released that show that every dollar spent on public health can save multiple dollars in future healthcare costs. For example, the CDC estimates that investments in public health can lead to substantial savings by reducing, the incidence of chronic diseases like diabetes and heart disease. And so this sort of myth often arises from a short-term perspective on, fiscal budgeting, but by failing to recognize the long-term benefits of preventative health measures, we may start to policymakers may start to underfund or defund essential public health initiatives, which can actually lead to increased healthcare costs and poorer health outcomes for America. And so it's important to recognize that public health spending is not a drain on the economy, as investing in public health can save money in the long run by preventing diseases and reducing healthcare costs within the population. And so this sort of myth that public health spending is a drain on the economy is simply not true. And we got this information from Trust the organization, or the Trust for America's Health organization. Our next myth is that health disparities are inevitable. Now, health disparities should not be inevitable and cannot be inevitable, as health disparities can be addressed through targeted public health interventions and policies aimed at inequities. And so disparities in health outcomes are actually often linked to, socioeconomic factors, access to care, and systemic inequities. And so there have been initiatives implemented like the Affordable Care Act, which aims to reduce these disparities by expanding access to insurance for a wide variety of groups. And so while, historical and systemic factors contribute to health disparities, targeted public health interventions can actually, yield significant improvements. For example, community public health worker programs have been shown to effectively bridge the gap between bridge gaps in underserved populations. So addressing these sort of disparities is not only is morally the right thing to do, but also a public health necessity to ensure equitable people for all. And so it's important to understand that these sort of health disparities that have arisen in America are not inevitable, and they can actually be addressed through targeted public health interventions and policies aimed at equity. And so it's important to create a wide and interdisciplinary approach to address these public health disparities in order to create a more healthier America. And we got this information from health.gov. Our next our next myth is that lifestyle choices are the only determinants of health. Now, that is not simply that's just simply not true, as social determinants like income, education, as well as the environment play, a significant role in health outcomes. Now, there's also other factors that influence, health outcomes, such as, healthy food access, safe housing, as well as the quality of education. And so these can all greatly influence health behaviors as well as their outcomes. For example, individuals in low socioeconomic status neighborhoods may have limited access to grocery stores which sell fresh produce, and can, as a result, impact their dietary choices. And so, focusing solely on personal lifestyle choices actually ignores the broad context or the broader context in which individuals live in. public health interventions must address these social determinants to create environments that support healthy choices and can ultimately, improve population health. And so it's important to recognize that there's other factors like income, education, food access, housing, and education, which can determine health outcomes as well as health behaviors. And so, in order to create a more healthier America, it's important to recognize all these factors and create effective policies that address all of them in order to boost health outcomes as well as increase positive health behaviors. So this sort of myth that lifestyle choices are the only determiners for health are the only determinants of health is simply not true. And we got this information also from health.gov. Our next myth is that the CDC and other health agencies overreact to health threats. Now, agencies like the CDC base their responses on, very in-depth data and research to protect public health, often in response to potential crises. Now, the CDC and similar organizations like the NIH rely on, epidemiological data and modeling to anticipate and manage public health threats. And so their responses are guided by scientific evidence as well as the potential impact on community health, for example, as seen by their response to the Ebola pandemic or the Ebola outbreak, as well as the COVID-19 pandemic. And so this myth that, the CDC mishandles public health can lead to public distrust in health agencies and undermine their authority and effectiveness at achieving their mission of boosting public health across the country. And so it's important to have transparent communication about the rationale behind public health recommendations, and so that is sort of essential to maintain public confidence and cooperation during health emergencies. And so, it's important to understand that the CDC and other health agencies have, based their responses to health threats on, very in-depth data and research that's been cross-checked. And so the fact that, or the myth that the CDC and other health agencies overreact to health threats is simply not true. And we got this information from the CDC. Our next myth is that public health is just about healthcare services. Now, public health includes, sanitation, nutrition, mental health, and education in order to, boost health outcomes. And so this shows how, that is more than just simple healthcare services. Public health initiatives address a wider range of factors that affect health, such as, water quality, air pollution, and mental health services. And so, for example, if you take mental health services, programs aimed at improving mental health access have become, increasingly important in recent years at boosting public health outcomes. And so, limiting public health simple healthcare services overlooks the I guess, broader spectrum of influences on health. And so, comprehensive public health strategies in order to boost public health outcomes and behaviors must include, environmental health, mental health, and community health engagement in health to promote overall well-being. So it's important to recognize that public health is not only focused on simple healthcare services. It's a wide sector that encompasses a wide range of different areas. And so we got this information from the World Health Organization. And so therefore this myth that public health is just about healthcare services is simply not true. Oh, sorry about that, guys. Our next myth is that everyone has equal access to healthcare in America. This myth, first off, is simply not true. Many individuals face barriers to accessing healthcare, such as cost, insurance status, as well as geographic location. And so structural barriers such as the lack of health insurance and the high cost of care disproportionately affect low-income and marginalized communities. And rural areas often lack access to essential health services, which can exacerbate disparities. And so recognizing that not everyone has equal access is crucial for developing policies that promote health equity. And so addressing these barriers requires systemic changes, such as, for example, expanding Medicaid and increasing funding for community health centers. And so at the end of the day, everyone does not have equal access to healthcare in the USA. And so it's important to recognize that in order to create effective policies that boost or that increase access to healthcare for everyone. And we got this information from the Kaiser Family Foundation. Our next myth is that health education is unnecessary for adults. Now, continuous health education is vital for all ages. It shouldn't just be limited to when you are a child, because health education helps individuals make informed decisions about their health throughout life. Adult health education programs address chronic disease management, nutrition, and mental health awareness. And I guess if you want to take an example, for example, programs targeting diabetes education can significantly improve management and outcomes for individuals living with the condition. And so, this belief that adults do not need health education can actually lead to poor health outcomes as knowledge gaps will continue to persist. Lifelong learning and access to health resources can actually empower individuals to take charge of their health, which can ultimately benefit communities as a whole. And so, yeah, this sort of idea that or health education is not necessary for adults is simply not true. As the world continues to evolve, it's important that adults continue to receive up to date and the most accurate and new health information from health education. And we got this information from the National Institute of Health. And so that's one thing that you can kind of see as we sort of busted all these myths is the sort of accuracy and the reliability of our sources, right? We've used, very accurate and correct and well fact checked sources that are really leaders in this field of public health. And so if you feel passionate about gaining information about public health, it's important to first find, accurate sources, as there can be a lot of misinformation in this field, as well as always cross check your information and make sure that you're receiving always cross check your information with other sources in order to ensure that you're receiving accurate information, and always make sure that the sources that you are looking at are reliable. And so that's super important when consuming information regarding public health. And so to end it off, health education, this myth that health education is unnecessary for adults is simply not true. And so that wraps up our myth busting for this episode. Now we are going to get into our weekly civic engagement segment. And so as we get closer to the election, we still want to stress here with Truth Tracker that it is very important that everyone gets out and votes in this election, no matter which candidate you support. It's important that you use your right given to you, as an American, and make sure that you get out there and vote, right? No matter what happens or no matter what candidate you support, ultimately it's important that you use your political voice in order to express your beliefs about where this country should be going in the direction that you want it to go in the future. Your voice matters, and your vote matters no matter where you are, in order to ensure that your political beliefs are heard in this country. It's important to vote, as oftentimes actually voting can help hold your elected officials accountable and make sure effective and efficient policies are enacted, which is one of the great benefits of voting, as it allows ordinary people to be involved in the political processes that determine or that are implemented within the country. And so that kind of really is a big benefit of voting, is that allows you to exercise your voice in the direction that you want this country to be. Again, if you have any questions regarding registration of voting or your local voting laws, please feel free to put them down in the comments. We will definitely make sure to answer them and help you out to the best that we can, because it's super important that we um, it's here in the media that we produce, or as media source, that we share accurate voting information in order to ensure that everyone has equal, equitable and I guess a large access to voting. As it's super important that everyone has access to voting, because voting is a very important right that everyone should exercise in order to make sure that their story and their beliefs and their voice is being heard. And so if you have not registered to vote, I would highly encourage that you get out there and vote and make sure that your political voice is heard in this election. If you have any questions about voting, please feel free to leave them down in the comments and we will make sure to answer them. And so, with that being said, that wraps up this week's episode. Thank you so much for everyone that tuned in. This week we busted 10 myths on public health, as well as held our weekly civic engagement segment. Like we said at the beginning of the episode, please make sure to subscribe if you enjoyed this episode, as well as like it if you enjoy the content from today's episode, as well as turn on post notifications. That way you can be notified anytime that we produce one of our new weekly episodes. And so, with that being said, thank you so much, everyone, for tuning in. Have a great day.